Assembling here. Valana, let me know if there are sound difficulties, or I assume you can hear me okay. Thank you. Hi, this is great. Well, today is our last day, my last day with you. So I will say I'm a little bit sad. I'm going to miss you. I've enjoyed as we've started getting going with the interactive chats and so forth. But we're coming to the end of the semester. So I thought today what we would do, as you know, I posted the assignment for the final exam last evening that you can see there in Canvas. You have a week to do that according to the deadline listed. And this is, this is an open book paper that you have to do addressing a policy analysis problem as we outlined in the syllabus from the beginning. And so I thought we would spend today on just a little bit of review and hopefully helpful guidance to you in how you prepare that paper as your final exam. And I'll just want to highlight a couple of points that I put in the instructions. So I'm going to share my screen with the slides from our last day on chapter 14 and talk a little bit about this. So we're going to do a policy analysis paper. Chapter 14 in your book is the guide for how you do this. I think I've indicated in the assignment, where you should look and some key requirements that you should pay attention to. The first comment I want to make is I decided to leave the approach of analysis to be your decision as to whether you want to use the rational model approach or the political model approach. Remembering that the rational model attempts to be a nonpartisan sort of analysis without factoring in values or politics of the analyst, but you just leave these pieces to the final decision maker to whom you're presenting the analysis. And remember, I said good examples of the rational model approach would be organizations such as the Congressional Budget Office or the National Academy of Medicine, who are supposed to be there to provide nonpartisan analysis for Congress. So you could use that approach if you want, and then just follow through. Or you could take the political model and recognizing that you may have certain values and certain judgments or politics that you are bringing to the process. And again, remember we have examples of analysis institutions or so-called think tanks that work on this model. For example, on the conservative side, the Heritage Foundation, the Cato Institute, the Oklahoma Council for Public Affairs. These are conservative policy think tanks. Or if you are more liberal or progressive bent, then the institutes that are examples of those are the Brookings Institute, the Oklahoma Policy Institute, and some others. I would say that the Henry Kaiser Family Foundation tends to be more on the progressive side. And there's a number of others, Families USA, and a host of different organizations. So it's up to you which approach you use in your paper. I just want you to be explicit at the front end of your paper which approach you're going to use. So that's the first thing I wanted to expand on and get out of the way. And of course, if there are any chat comments or things you want to bring to this, don't hesitate, okay? But this is the first thing. Decide which type of approach you're going to take to this problem, and go from there. But tell me, in the very first paragraph of your paper, which one you're going to do. When we come to the structure, this is outlined in the book, and again, I've directed you to follow the book, and if you have your book open and you're working through it as you do this, you will do well. I decided to identify the problem for you. So I've provided number 1 in the 5 steps with the question or the assignment that I've given, which is to, analyze some options for expanding Medicaid in Oklahoma. And this means then you have to address items 2, 3, 4, and 5 in the 5-step policy analysis approach. Okay. Also, I don't expect that you have to go beyond the options that I've mentioned. Of course, in an open, broader policy analysis, the client would be asking you to identify the options. But here again, since this is our first one, and to put some boundaries on this, given the short time you have, the week to do it, which is a good time, but I think it's your first one, and I think that there's really just the options I've listed. You don't have to add extra options, okay? The way the problem has been framed for you, not expanding, which would be one of the options in a more open-ended question, is not an option. We're assuming that Oklahoma is going to expand, given that the governor has submitted a proposal to expand. But which approach are we going to use is what you're really looking at with the 3 options that I've sort of mentioned there. Okay, so that puts some boundaries on it in your work and your research, and you can go from there. Use the appropriate tone, but again, if you are taking the so-called political model approach, you can infuse your analysis and commentary with, some value judgments. Obviously, I think that if you are you're taking a very progressive approach in which you are talking about the values of, health equity and covering all people and universal health coverage and all of the importance that brings. If you take a conservative political viewpoint, then you'll be taking more a market justice viewpoint and cost containment and fiscal responsibility and personal responsibility arguments towards the approach to be taken here. Okay. So any questions on that, please submit through chat and we can address that for you. Okay, here's one. Is the step 2 of the 5 steps a overall background review of Medicaid? I don't think you have to go, no, you don't have to go into, all the kind of detail, way back into the history of Medicaid and all of those things. I think you can just say that really I would start with the Affordable Care Act 2010, and that the way that the Affordable Care Act sought to expand healthcare access to the low-income people was through Medicaid expansion, that the Supreme Court decided that this would be up to the states, that the federal government could not force states to undertake Medicaid expansion. Nevertheless, because the federal government provided very significant incentive to the states from a financial point of view in the payment sharing of it, right, and 90% to 10%, you'll review your notes on our discussion of this in class. It was 95% for the first 5 years and then 90-10 after that. Because the federal government provided a very attractive incentive for the cost sharing of the expansion relative to what the normal Medicaid expansion is, that many states opted to do this. And so there were 37 states as of earlier this year who had decided to expand or had expanded Medicaid, and about 14 states that had not. And then you can say Oklahoma has finally progressed to addressing this issue definitively, that there's, you know, and so there's options. The citizens have come together to get sufficient signatures to forge a ballot initiative, State Question 802. And you should review that plan, and not in the background so much, but in your options and what you do there, landscape and so on, as to what that plan entails. The governor submitted his plan because he doesn't want to do State Question 802 approach. Really, the key distinction here that you want to look into and also note is that the big overarching concept of block grant versus entitlement program, right? And that's a key difference. Or is there some other, you know, other approach to this? So that's what should be in the background. Just that, you know, not a long, tedious discussion of Medicaid, but just the pertinent facts, explaining to the reader where we are and why this is an issue for Oklahoma at this point in time. Okay, it's a great question. Are there other questions so far? Okay, so here the problem identification which I've given you is relatively narrow. Here's the general information on the background that we've just been through and discussed. I think you can, you know, I don't think you're writing an analysis. You can decide at what level you want to pitch this with regard to, you know, the information provided. And I would not assume that the general public just, you know, doesn't want to know this. I think it's important, but, you know, try not to use jargon or to define terms. When you use technical terms, you should define them or tell people what they mean. Okay. The landscape is a very important section. And again, you know, here's just a summary of what that does. Talk about the stakeholders, you know, who are the interested parties, particularly with respect to Medicaid expansion. Clearly, there are several there. Again, and your book provides more detail that you can follow along. The different aspects of the problem that you should consider, these different factors. And this is right from your book, and you're allowed to use your book and have your book open as you go through this. And they, you know, they flesh that out in more detail here regarding some more specifics of these different factors. Political sale this is a front burner issue. This is gonna, assuming that we have a little bit of, you know, stability with the COVID and so on, and that people can turn their attention to this, I think it will be a front burner issue in the election. Typically that begins to happen after Labor Day. So you may not see that yet, but I think it will be a front burner issue. So you have social, you have economic, you have practical, legal, and quality of care factors to consider in your landscape section. Then we're just discussing the options. So a question, Callie, thank you. We're just discussing the options that I've listed in the problem identification in what I posted about the exam yesterday. In other words, it's the options for Medicaid expansion and what I listed in that.
talking to, mister? Do you want me to make this coffee or what?
So if you're, Madison, okay, Valana, can you hear me? I got a message that I was muted.
Dean Raskob, you've been unmuted, but everyone else has been muted and no longer allowed to unmute themselves.
Okay, that's okay, but they can still chat, right, through the chat.
Yes.
Good, excellent. So to respond, Callie, you're just discussing the options that I've listed in the problem statement. And Madison, yes, you don't have to write your problem identification. Just use the one I gave you. Okay, I wanted to make it more easy for you. So you can just then focus on the other aspects, right? So if we go back, my, go down here. So let's go back, Madison. You are going to focus on items 2, 3, 4, 5 using the problem identification statement that I've given you already. Okay? Is that clear, everybody? Someone answer for the chat. Okay. And again, I think you've got a book, you know, with a great outline. Follow that outline. That tells you what I'll be looking for in this as we go through here. And I would say, you know, you're going to discuss different factors. You are in the landscape, you can decide whether you organize that by stakeholder or by factors. So that'll be up to you. Stakeholders, of course, would be the people, you know, the uninsured people who would receive insurance, the general public, the governor, the legislature, the healthcare profession, the hospitals, the rural hospitals are important stakeholders to Medicaid expansion. Or you can organize this by the factors described in box 14.1. This will be up to you which you choose. So here we've answered that. It's not 3 to 5 options. It's just the options I've listed in the problem statement. I do want you to do a descriptive side-by-side table, which is a good way to help organize your thoughts. I would think that you may want to, you know, do fairly early in your response, develop the table, because it'll help you write, you know, the rest of the document. And then I want to hear a recommendation that you have. And a very important clue to you, I would, as you do, I would use this checklist, okay, as a guide for yourself. So there's a lot of structure to this. This is about following a structured policy process. It's not about memorizing all this stuff. You have a template that you use, and I think, you know, is a good guide for you. So do that and follow the book. Any questions follow on from there? Okay, so let me see. I want to go to the question that I did. Valana, can you, is it possible to, or somebody, to read the question, the problem identification that I put? I don't have it here.
Sure. Give me just one moment.
Yeah. I want to talk a little bit now about sources of information for you as well. But I want to see your own research. You are very good at finding different sources. You can search that. This will be an easy topic to search. I would think about looking at other organizations like the KFF, Henry Kaiser Family Foundation. I would look at if the Robert Wood Johnson RWJ has anything. Okay, great, thank you. Putting that in the chat. So, yeah, I see why there was a question about number of options. So you're going to look at the plan described in State Question 802, Sooner Care 2.0, or some other plan. So one other option, so that brings the total to 3. I don't expect you to look at multiple other alternative plans. Generally, if you want to look at an alternative that might be interesting to look at is the one that Arkansas used. And I would encourage people to look up that, where they contracted with private insurance to develop a plan, and the government then gave them the money. So subsidized private insurance. And if you go back to your notes and things from the Intro to Public Health class, some of the articles by Dr. Summers, and I believe I included some of those in there that looked at evaluating these. Essentially, it showed that if we do a subsidized private plan, with the exception of mortality, where we don't have the data, but the other things are generally similar to what you would get with Medicaid expansion. Okay, but it's only these 3 options. State Question 802. So you can dig, they have a website and a lot of detail available. Sooner Care 2.0, you should look at that plan as much as whatever the governor's put up on that. If you don't have information or you don't know things in your table, just put it's not known what this will be, or some alternative plan. This is great, Valana, thank you. Okay. So I think this problem is one that's very pertinent to Oklahoma right now. I don't think it's all that difficult. You have a week to do, and it's just a matter of sitting down and methodically working through that. Dawn, I think you can, the paper should be 5 to 10 double type spaces, pages, charts. That doesn't include your side-by-side description of the options. That table doesn't count in the page links. And you can have other charts and tables, as many as you want, which doesn't have to count in the length, because, and that's usually how, now when I write for journals, they have a word length and they may say 5 tables or something like that, but I'm not going to put limits on you. Keep it flexible to meet your needs. Now, if you come in with 41 tables or something, I'll have questions, but I don't think anyone's going to do that. Just, use what you need to get your message across. But one of those tables must be the side-by-side description of options. Okay. Any other questions about this? Clear? Valana, can you think of anything I should clarify or add? Okay.
No.
So again, when you do your research, again, I would look at, sources. I would look at the New England Journal of Medicine, their policy section. There have been some papers about, as you know, Governor Stitt's program will have work requirements and will have co-payments or premiums by the participants. What do we know about how this will influence things? Health Affairs, the New England Journal of Medicine, you can access those through the OU HSC library. those are good journals to search for relevant articles, because this is very topical. Some states have been implementing work requirements, and again, you can see what that is showing. That might influence your analysis. The Henry Kaiser Foundation, Robert Wood Johnson, the other agencies, these independent agencies can have added information for you. The Oklahoma Policy Institute would be a good one to look at. The Oklahoma Council on Public Affairs, if you want to take the conservative angle to it. Okay, yeah. So I hope I've clarified what the distinction is between the rational and the political models for this type of analysis. You should use statistics wherever you need them to support your arguments throughout the paper. But I want you to take one or the other approach to this, just a completely nonpartisan or a political side, and analyze and argue that way. My goal is that through this, all of you will learn quite a lot about this issue, and that you can then, over the summer and fall, be educating your colleagues and citizens that you come in contact with about this important issue, which will be on our ballot in November. I'm sorry, State Question 802 will be on the ballot at June 30th. So it's very topical. The governor just made that announcement several days ago, right? June 30th will be the vote on State Question 802. Other questions from our students? Glad to see so many of you here today. This is great. Okay, so that's really all I wanted to go over with. I think it's a straightforward assignment. It's a bit of work, but I think, I will enjoy reading what you come up with and what you say. Remember that the paper is due by midnight, 11:59 on Wednesday, May, I believe it's 6, correct, Valana? Yes, here it is in the yep, Wednesday evening, May 6th at midnight is when your paper is due. And please submit that to the Dropbox in Canvas for this course. So that's all I wanted to go through with you today. Is there anything else students would like to ask or talk about before I make some closing comments? Okay. So if not, okay. Yeah, good. Thanks, Valana, for that. The final paper Dropbox is different from the extra credit Dropbox. Very good. And there were a lot of good things in the extra credit, and appreciate those assignments as well. I want to say that I'm really proud and appreciative of all of you. I think this has been a very unusual experience this semester with the COVID pandemic and how that impacted us. For me, it's a once in a lifetime experience. I hope that all of you won't see many of these pandemic situations through the rest of your life. However, we look at this, there have been 3 potential pandemics in the last 10 years, SARS, MERS, and the COVID-19, one of which really took hold and did become a major global pandemic. So from a perspective of a time to be exposed to public health, you certainly are living frontline core public health every day now. And I think we will be for, I would say, 2 years, because it's going to take a year to 18 months to get the vaccine. It's going to have to then be deployed and implemented. We're going to have to build herd immunity in the population. And it's likely that then COVID will become something like flu is in our society. Hopefully we can get a vaccine. You probably saw today there were some encouraging announcements about an antiviral drug. Maybe a little overdone, but still encouraging for the antiviral drug remdesivir. Research is going to go at a very strong pace. That's something that's been really rewarding to see, is how fast research has progressed on this kind of thing in a short time. But you all have managed this very well. I can't even begin to, express that I don't understand all the impacts on all of you. We've tried to do our best to get you through this class, to make it a good, worthwhile learning experience. We very much welcome your feedback. So in the anonymous course evaluations, please complete that and give us all the comments you feel appropriate that we can use to do a better job going forward. We are about continuous lifelong learning and continuous quality improvement, and all health professionals should be dedicated to, lifelong learning. And we'll continue to go forward. I hope that in the fall, again, for you public health majors, it's likely that in the fall we are going to an approach where we have all the major courses available every semester, to give students more flexibility as to when they do that. At least that's what I'm hoping. That's what the Dean of Arts and Science and I both want to do. I think the number of majors will grow, but again, flexibility in when we can offer these, and we'll have added faculty joining in. So tell us your thoughts, help us improve, help us do a better job for you. Your success is our mission. I hope to see some of you in future classes. I hope to see some of you ultimately in our graduate programs or in other health professions at the OU Health Sciences Center. If you have aspirations to go to other universities after your bachelor's degree for public health or so on, and we can be of help, don't hesitate to contact us. And I hope that you've enjoyed and learned something from this. I've certainly enjoyed working with all of you. And I want to wish you good luck on the final exam. Good luck on all your finals. Have a very a safe summer. Be careful out there. Follow good public health practices. Please, everybody, when you can, when you're going outside, wear a mask. If we can inculcate the culture of wearing a mask when we're in public, this will go a long way to reducing the spread of this infection. This is pretty much advanced in Asian societies even before COVID. And I think if we can do that, it's a courtesy to others. We can help this. Remember that you all are very young. Many of you are healthy without other health issues. Some of you have some health issues that you need to be careful about as well. But we can all be asymptomatic carriers of the virus that we could bring back to loved ones in our family, our parents, our significant others, or our grandparents. So let's do that. Thank you all for the kind comments. I appreciate all of you. Again, I want to see you when we're back in the fall. If some of you are on the health sciences campus in the summer, don't hesitate to contact us. again, university will be releasing plans soon about how the reopening and the transition back to a more physical presence will happen. But don't be strangers. Come and see us on the Health Sciences Center. I know some of you will be there as medical students or other students in the fall. And we look forward to it. Have a great summer and practice good public health. Be ambassadors for public health for me, please. Go out there and tell everyone. And we wish you all the best and good luck. So have a great rest of the day, and thank you all.